Hi, my name is Blessing. I'm going to be a nurse. So can you tell me your name and your birthday?
John Edwards, February 1991,
Alright, so can you tell me what birth you're in today?
annual checkup.
So I have a few questions to ask you, though, but do you have any chest pain recently?
No,
Do you feel any shortness of breath?
no,
Do you have any cough?
no.
How many pillows do you use to sleep at night?
One,
Do you have any any history of heart diseases?
no.
How often do you wake up at night to urinate?
Usually zero.
Okay. So facial skin, do your facial skin ever turn blue?
No,
Do you feel any dizziness or lightheadedness?
no,
Do you feel tired easily?
no,
Are you on any current medications?
no,
Do you smoke?
no.
Do you use alcohol?
Like once a month.
Okay. So your BMI, what's your BMI level?
It's about 34.
Okay. And do you know what you weigh?
217.
Okay. So patient has actually a high risk for like heart problems probably in future if not taken care of properly because patients' BMIs are actually over 30%. There are no extra fluids in the extremities. So I'm going to perform his carotid artery. So I'm going to take a look over at his. Thank you. So around here is actually um his jugular vein area. This is like the internal jugular vein, and that's like the external jugular vein there. And placing my light pen across it, I'm looking out for any pulsation. And I can see it has a slight pulsation around the jugular vein. And there actually no distension or bulginess, bulginess, bulging or around the area, so it doesn't look tender or bulgy. And now I'm going to feel the patient's carotid artery for the pulsation. Okay. I need you to look straight at me like that. So actually his pulse is +2 and it's actually regular beats bilaterally on both his left and his right side. So I'm going to, after palpating the patient's carotid and listening to the sounds, I'm just going to listen for any bird sounds. So where are your pulse? And I'll need you to hold your breath, please. All right, thank you. So there are actually no wheezing sounds when I listened to the patient's carotid pulse. There are actually no wheezing sounds around there. So the skin color, there are no redness or swelling. The facials, they actually now paler color, or there are no um, wounds or cuts around the patient's face and skin. The hair are actually, there are no loss of hair on the patient's skin, and they're all both bilaterally, and the patient's skin feels um, not excessively moist or wet, but and also it doesn't feel dry either. So The apical pulse. Patient's level of consciousness. Patient is oriented to name and date of birth. And the carotid pulse, like I said earlier, is actually +2 and it's regular. And the point of apical impulse. So I will be identifying like the apical areas by actually assessing it by touching wherever my stethoscopes are. So we have the aortic, we have the pulmonic, we have the herbs, we have the tricuspid, and we have the mitral. So here, so while assessing the patient's PMI area, which is right from here towards here, the PMI area shows like there is a lift while patients breathe in and out bilaterally, and there is actually there is a pulsation right at the right close to like the fifth intercostal space, and so there are no trails when I feel the patient's PMI areas. And also, I'll be auscultating the patient's aortic area for the S1 and the S2 sounds. First, I'll be using the diaphragm. So right now, I'll have to locate the second intercostal space for the aortic and the pulmonic. So the first as a sub. That is the angle of Louis, which is the second intercostal space. And I'm just going to go across it to the right hand side right here. That is the second intercostal space on the right. That is where the aortic valve is located. And I'm just going to place my stethoscope around there to listen for the S2 sounds, which is the dub sound. And also to listen if there are any extra sounds as well. So I'm just going to place this in there. So there are no extra sounds there. All I can hear are just the dub sound. And I'm going to move it from here, which is the aortic on the right hand side, to the pulmonic valve, which is located on the second intercostal space on the left hand side. So I can hear the lub dub sound, but I could hear the dub sound more than the lub and in the semillunar area. And also I'm going to move it down to the third intercostal space to listen to the herb sound, which is going to be 2, 3. That is the herb. So there are no extra sound on the third. And I'm going to go down to the fourth intercostal space. So I'm going to listen to the tricuspid sound, which is between the fourth and the fifth intercostal space. So there are also no extra sounds or murmurs. And I'm going to go down to the mitral valve, which is actually in the fifth intercostal space by the mid-clavicular line. Just gonna move a bit down to the left, which is the apex. So there I could hear, so the aortic valve, the pulmonic valve, the semilunar valves, and those I could hear like the S1 sound, I mean the S2 sound, very well. While the tricuspid and the mitral valves are where I could hear the S1 sounds, accurately, and the S1 sound is the closing of the AV valves, and while the semilunar valve is the closing of the S2 sound is the closing of the semilunar valves. So, so I am actually going to listen to the patient's heartbeat, for a minute to be able to assess the patient's rate and rhythm. And so I'm going to listen to your heartbeat in a minute. So that'll be at the 5th. So the patient's heart rate was 66 beats per minute, and it was actually regular. So I'm sorry. So I'll have the patient lay on his left hand side so I can listen, to his lateral position, to the apex as well. So I'll have you lay on your left hand side. I could hear like some popping sounds, kind of. I believe that should be based off on the position the patient is on, but I could hear like some popping and bubbling sounds around the fifth intercostal space. And I'm also going to listen to the patient's bass while the before I do listening to the patient's bass while the patient is sitting down. I would actually have to listen to the patient's anatomical valves, starting from the bottom back up with the use of my bell, of the bell stethoscope. So I need you to lay back where you were, flat. So initially I used the diaphragm, so now I'm going to use the bell to listen back up, okay? So I'm going to use the bell to listen. Okay, so that is the S1 sound in the mitral valve. Then I'm going to go up to the fourth, between the fourth and the fifth intercostal space to listen to the tricuspid valve with the use of my bell, which is right here. There are no sounds right there. I'm going to go up to my third intercostal space and listen to the herb, which is right here. There are no sounds right there. I'm going to go to my second intercostal space to listen to the pulmonic valve, which is right here. There are no sounds, which is, I can hear the dub sounds, which is the S2 sound. And then I'm going to go to the right hand side on the second intercostal space to listen to the aortic valve, which is right here. And there are also no heart sounds as well. And that is where I can listen to the S2 sounds, and it's actually when it's the closing of the semilunar valves. All right, so now I'm gonna have the patient sit so I can listen to the base of the patient. The base is right above here, the base, the top of the heart, and this is the apex area. So I'm gonna listen to the base of the patient. Okay, so I'm gonna have you sit up so I can listen to you. Sorry, you okay?
Mm-hmm.
So I'm still using my bells side to listen to the patient. I think our hair sounds more better with the bell too. So I'm just gonna. All right. So I just listened to the patient's base sound, and there are actually no irregular sounds. The rhythms are actually regular. There are no extra sounds to it. There is no murmur sounds to it. So the patient's um, apical, oscillation of the heart sounds okay to me. Do you have any questions or concerns?
No.
No. All right. Thank you.